Hi, everyone. My name is Tim Reha, host of Digital Health Live here at the HeathTech Summit. Made a special trip down to catch up with some really cool entrepreneurs. And so we got a really cool demo here with my friend Marcus Rosenthal. Did I get that?
Yes, you got it.
Okay, cool. We met over lunch, but I saw you at the Robots on the Runway event that Jill Gilbert at CES.
Yeah, definitely. We did a little reenactment of the Demolition Man scene of Robots on the Runway back then. And so I'm with Revolve Robotics. We're the maker of Kubi, and Kubi brings access to clinical care or any medical support really anywhere, and in a very simple, engaging, and affordable manner. And it integrates and works with any tablet, any video service, and you can put it onto carts like you see here, or you can put it right on a tabletop. And so it's just a great way to bring in specialists into rural locations, satellite offices, anywhere where you need a caregiver or live video interaction you can bring in with the Kubi.
Now, who's on the Kubi right now?
So Jeff is our VP of marketing, and he could talk about how it is to drive it and some of the customer use cases.
So I'm putting my mic, he has a mic down here. Hey, how are you doing?
Pretty good. So I'm Jeff Goldsmith, VP of Marketing at Revolve. And this device can be used for many different things in business, education, healthcare. And we're at a healthcare conference, so, kids who are homebound now can go to school using Kubi. They're in schools in Texas, in Connecticut, Washington State, going to school, connecting with friends, even though they have serious diseases at home or in the hospital. And doctors, specialists in teaching hospitals can go to affiliate hospitals instantly to diagnose stroke patients, to visit people quickly without actually having to drive there. And there's a huge cost savings in both instances, and there's a clear ROI on this process.
So what I like right off the bat is it's more of this telerobotics versus just a dumb screen sitting there. He can actually. How are you pivoting the screen, and what's your app experience like to drive this?
So I'm moving the robot by clicking on the screen or using scroll bars. It's super easy and intuitive, and I have two saved views, one of you and one of the camera. So I just clicked on the one of you, and I turned right back. Super simple.
Yeah, so it really doesn't take much of a cognitive load for the remote person to be controlling to look wherever they want, which we find to be very important because you want to concentrate on the care or the interaction.
So this is the front end of part of a more sophisticated engine that you built.
Right, yeah, so we have a software platform that enables these controls that all go through the cloud. And with our APIs, they can get integrated right into video applications. So VIDYO, they have an integration, and Zoom, both of those have integrations that are available today, and we're working with some other providers.
And I imagine you could pair this up with other health sensors, so you could also be looking at real-time health data from folks in the future or now, along with the telepresence?
Yeah,
is that
exactly? So we have some integrations that connect stethoscopes, blood pressure monitoring, all sorts of optical
Bluetooth-enabled devices?
Yeah, so Bluetooth or wired. So this works with Windows tablets. So a number of hospitals are locked on using Windows devices, so you can use it with those as well. But certainly with the Bluetooth connectivity, you can get all sorts of great peripherals.
What's the business model? Who's the actual end customer, and how's it paid for?
So the end customers are usually the providers, the hospital systems, and so it's paid for through the services that they're looking to provide for telehealth. So the technology that they're bringing in, 19 states are doing reimbursements for Medicare, Medicaid, telehealth visits for chronic.
So my stepmom's in Hawaii, super remote. She gets diagnosed with something. We could send this out to her, and now she's connected into a more connected system.
Yeah, exactly. Especially like
better experience.
Alaska and Hawaii are two places where it's pretty difficult to get into care, and so this by deploying these at the homes, especially to help prevent readmissions, so then clinicians can connect with them or families can check in on their elderly parents or grandparents.
So why did you come to the HeathTech Capital event?
Well, so we've recently just started focusing on healthcare use cases for Kubi, so we wanted to be here. In fact, we attended last year, and we were in the Zoom booth. So Zoom was here last year, and since then we've got the integration with them, and we actually met the lead investor on our seed round here at HeathTech Capital.
Oh, wow, cool.
It was a very productive event, and then we wanted to connect with some of the providers. So we participated in the matching event, which I found very worthwhile. So actually 2 of the companies we already have Kubis deployed at, and 2 we didn't yet. So, but all of them were new contacts, and so helped me to understand how they go about evaluating new technologies and the process from pilots to full adoption, and what they're looking for.
So you get to fill out your dance card, meet pre-screened, well-connected folks that can help you scale the business. Now, they get the stand, or what's the whole package?
So Kubi is actually, it means neck in Japanese, and it's the part from here to here that holds the tablet. It's got a standard camera mount on the base, so you can put it onto tripods. This is a Jayco Kubi cart, so they're one of our partners that have this nice, rolling base that works great in, inpatient.
We're going to ghost ride you down the hill a little bit later just to test your stamina.
And we've added, you can add accessory speakerphones. So this one's a pretty powerful one that's by Phoenix that really kind of, when you're in louder environments, can overcome that.
Because you're doing healthcare, you have to have HIPAA compliant cloud, secure connectivity and all that for the communication layers.
Right, and so that's why we partnered with Video and Zoom, because they both have HIPAA compliant applications that are already deployed in many healthcare situations, and so then all the HIPAA compliance is on those services.
So would you like to add anything to the conversation here?
Well, I think that we have a great opportunity to improve healthcare in this country. There are costs are going up, and there are not enough caregivers, and there's an aging population, and we can become a workforce multiplier to bring more care to more people faster, saving money and saving lives, quite frankly.
And improving the lives of the caregivers as well. So they're not, they're not driving all around frantically. They're only going there when needed. Doctors and specialists can serve many more people from their homes or their home office, as opposed to spending all this time driving, where they really often don't need to be. So many of the interactions.
I live in Seattle, and you can't even go anywhere.
Yeah. I'm in San Francisco, and both times when I was driving down, or the past 3 days where I've been down here, it's like, I'm so glad that we're creating a technology that's helping minimize the amount that people need to be sitting in traffic like I'm doing right now. We're not bringing any value to the world by sitting in traffic.
So hey, that's Marcus. The company is Revolve Robotics. How do people connect up with you?
RevolveRobotics.com is our website. You can even test drive one that's sitting right next to Jeff there.
Okay.
And love to, discuss pilots or any sort of demonstrations with anyone who's interested.
All right. Well, hey, thanks for being on the show. You guys added some cool factor, and it's a very high touch product. I like it.
All right. Thank you.